The length of your recovery at home depends on your general condition and how severe the heart attack was. Your doctor will tell you how long this should be. During this time, you'll need to take special measures to help you heal and lay the foundation for a healthier future.
Before my cardiac arrest, I just assumed that I was very healthy and alive, and I'd stay alive. It was easy to stay alive. And now I realize that I have to work every day at staying alive, that I have to work at eating the right foods and healthy, and I have to work by exercising and let my body prove to me that it can, it'll stay alive and that I can keep going.
In this segment, you'll learn about taking medication, eating well, self-monitoring, balancing rest and activity, making follow-up appointments, gradually increasing your activity level, and managing your emotions. Most heart attack patients leave the hospital with medications to help prevent further heart problems. You'll see these on your discharge sheet, and someone on your care team will go over them with you. Listen carefully, ask questions, and take notes. Make sure you understand what you're taking, why you're taking it, and how to take it. At home, take your medication as prescribed, and take only the medication you were prescribed. If you were already taking medications, herbs, supplements, or over-the-counter medication before your heart attack, it's important to check with your doctor to see if you should keep taking them. Don't stop taking any medication unless your doctor tells you to. You may leave the hospital with a small supply of medication, but you'll probably need to refill this prescription at your regular pharmacy. Ask your care team if you have questions. Finally, tell your doctor or pharmacist about any side effects you notice. This information can be important to your care. Good nutrition is important for your heart health. After a heart attack, you'll be given a heart-healthy eating plan that you need to follow. The eating plan might mean adjusting your routines, but the change will be worth the effort. Along with the eating plan, here are some general tips. Eat small, frequent meals. Big meals make your heart work harder. Eliminate or cut down on caffeine found in coffee, tea, many sodas, and chocolate. Caffeine increases your heart rate and can cause problems with your heart's rhythm. To help make sure your recovery stays on track, pay attention to your symptoms. Weigh yourself every day and write down your weight. You should weigh yourself first thing in the morning, after you've emptied your bladder, but before you've had breakfast. Your doctor will tell you the amount of weight gain to watch for. Generally, you should call your doctor if you gain several pounds in a day or a week. Notice your heartbeat. You might feel an irregular heartbeat or racing heart, but if it lasts for more than a few seconds, call your doctor, especially if you feel lightheaded or weak. Watch out for chest pain. It is not normal to have chest pain like your previous angina or heart attack pain. If you do have chest pain, follow these steps. Stop what you're doing and sit or lie down. If you've been prescribed nitroglycerin, take it to see if it relieves the pain. Remember to sit when taking nitroglycerin. It might make you feel lightheaded. Take one pill and wait 5 minutes to see if the pain is relieved. Repeat up to 2 times, a total of 3 pills, with 5-minute rests in between. If your pain is still not relieved by rest or nitroglycerin, call 911. Wait for the ambulance. Don't go to the hospital in a private car. Right now you need rest and activity to help your recovery. Here are some tips for balancing the two. First, get at least 6 to 8 hours of sleep every night. During the day, take naps if you like. Just don't let them interfere with your nighttime sleep. Limit your social activities. Keep visits to about 10 minutes for the first few weeks. Going to the movies or out to dinner are both fine as long as you take it slowly. After a meal or sex, rest for 30 minutes or so. Take frequent, short breaks throughout the day. You can keep up with most of your regular at-home activities like personal grooming, light housework, and going up the stairs. Just take things slowly and rest when you need to. For the first few weeks, there are several things you should avoid. Heavy housework or yard work like vacuuming, scrubbing the floor, mowing the lawn, or shoveling snow. Lifting anything heavier than 20 pounds, or any other strenuous activities that leave you out of breath or overly tired. Cardiac rehab staff will work with you to make a plan to increase your activity during your first few days at home and then work into regular exercise. Participating in outpatient cardiac rehab is strongly encouraged and can help to keep you on track.
I didn't know most of the people working out over there, but we have become very good friends. We meet sometimes at 11:30 for lunch together, and we are supportive of one another and helpful of one another. And I think if you can at least get one other person to work out with you, you need all the support you can get. You need someone to say, I know you don't want to go, but get up and go, and I'll go with you.
Your activity plan will tell you how often, how long, and how hard to exercise. It will begin with very light exercise several times a day for just a few minutes. Week by week, your plan will help you build up to longer and harder sessions once a day. As you use your plan at home, follow these guidelines. For the first few weeks, stay in your house or very close to home for your physical activity sessions. If you leave the house, take someone with you.
Doing this activity, a level of activity to kind of get your heart rate up and test your system like you can do it, it is reassuring, and it's like a trust. You've lost trust with your body, and now you're building that trust back up. And these little exercise is that relationship building with your body and that trust. And I remember the first time I went out running by myself, I made sure I had my cell phone, I had my nitro pills, I had my anti-anxiety pills. I had all the safety mechanisms, and my wife, I know she wasn't sleeping. She was downstairs and it was the morning, and she wasn't sleeping because she knew that I was going out to go for a run. And but it was interesting, kind of raining that morning, and it felt so good. It just felt, you know, the rain was just barely coming down on me. It was a light rain, and it was actually cool and refreshing, and I was out alone by myself, and you know what I mean? I felt okay. I didn't feel like I was going to collapse or anything. And it was just a very positive experience, and it kind of, you know, was a catalyst and just a great memory that I keep.
Start each session with the gentle warm-up moves that you learned in the hospital, and avoid exercising in extreme heat or cold. Don't exercise so hard that you're exhausted. After a session, you should feel a little tired, but not so tired that you need to lie down for hours. You can start going to outpatient cardiac rehab within the first few days. The cardiac rehab staff will communicate with your care team to keep them up to date on your progress. Your care team will also ask you to schedule follow-up appointments with your cardiologist, your surgeon, and your primary care provider. Be sure to keep these appointments. Your care team needs to see how you respond to treatment, how your recovery is progressing, and whether they need to adjust your treatment. After a heart attack, many people are eager to get back to work and the comfort of a familiar routine. Your care team will give you advice on returning to work based on your individual condition and the type of work you do. Likely, they'll tell you something like this. First, don't hurry to return to work. Your heart deserves a chance to heal. Expect to wait at least a few weeks. When you do go back to work, ease in gradually. If you can, arrange for shorter days or lighter duty assignments. Don't drive until your care team tells you it's safe. You'll probably need to wait at least several weeks to make sure that your reflexes and your strength are up to the job. If you're riding as a passenger, try to keep trips short. On longer trips or flights, stop the car or get up from your seat to walk around and stretch your legs. This lowers your chance of blood clots.
I hope that everyone else who's in my position has a cardiovascular disease and a heart attack or something like that has somebody in their family that can be supportive like that. And maybe it'll take 2 or 3 people. Maybe it's a friend, a spouse, a brother, a sister, but you know, realizing that those folks really do want to help out and they have the energy to do it. It's okay to let them help you and ask for help.
If you watch the Heart Basics segment, you know that as a heart patient, you'll probably have emotional reactions to your heart problem, such as worry, anger, or fear. These are normal and typically ease over time. Reach out to friends when you need encouragement. Your healthcare team can put you in touch with a volunteer, counselor, or religious guide. And we can connect you with a case manager if you need practical help with transportation or sorting through bills. Talk to your doctor right away if you start feeling you want to give up on life. This is a serious symptom of depression, which your doctor can treat. Other symptoms include being worried or sad much of the time, not being able to sleep or sleeping too much, or losing interest in things you used to enjoy. If you have any of these symptoms, especially for longer than a few weeks, tell your doctor. Depression can be common with a heart problem, but you deserve a chance to feel better.